let's switch gears now a little bit and talk about false positives and follow-up after cancer diagnosis. I know that a few long-term outcome studies from the original DETECT-A were presented at ASCO. Could you talk more about that?
DETECT-A, it was a study that evaluated an early version of the CancerSeq in about 9,000 women without a history of cancer. This was a study that looked at long-term follow-up of these patients. And what this showed was that half of the patients with a MCED detected cancer were successfully treated and cancer-free over 4 years after their initial MCED test. And over half the patients in remission had cancers with no standard of care screening. So they never would have been identified but for this test. And all patients with stage 1 or stage 2 cancers who were treated remain cancer-free. So this, again, is a proof of principle. The second follow-up study from the DETECT-A looked at long-term outcomes of a false positive event. There were 98 false positives. I think the takeaway from this ASCO abstract was that false positives are uncommon. They represent about less than 1% of individuals tested. And for the patients where there wasn't a finding on imaging or further diagnostic, less than 1% of those few remaining do end up having a cancer come back. So I think this is helpful and hopefully indicative of a lot of the MCED platforms that false positives are rare. And even if you get one, they're pretty easily evaluated as false positives with minimal follow-up.
So as a clinician that is currently ordering MCED tests, I know that it is reassuring to me and to my patients when we talk about the false positive and false negative rates associated with this kind of platform. And as these kind of tests continue to mature and we gather more data, as well as improve our diagnostic imaging and evaluation, really hope to continue to see that kind of high specificity with these tests so that we are not doing unnecessary workup for our patient, causing more anxiety, etc. Thank you, Dr. Schram.